Hello everybody, my name is Dr. Cory Singer with Singer Chiropractic Wellness Center. I'm here to talk to you today about low back pain. It's the kind of thing that so many people deal with in the world, and I just want to stretch out to you guys and give you a little bit of information to help yourself out at home. So what is low back pain? What causes it? It's that pain where you just get it, you wake up in the morning, you're just feeling that achiness right there, or you're walking around all day and it just bothers you. Hard to do the dishes, hard to get out of bed in the morning, it's just terrible. So what can cause that? One of the major causes of low back pain is just the fact that people are sitting down for hours upon hours upon hours during the day, and it just starts to slowly break down the low back. There's all kinds of different things as well. I mean, you could get an injury, could take a blow, something like that, lots of different things. Different things could come of those things, including disc herniations of the low back, arthritis can start to cause, as well as even just some general muscle ache and pain in there. So there's one condition that chiropractors are especially designed to treat, and that's called a subluxation. And I'm just going to go into a little bit about that and actually what it can cause, okay? So first of all, let me show you here. So this would be a takeaway of your spine. So say if I took this out of your low back like this. These are the bones, these are the discs, and then these are the nerves that come out the side right there. What can happen is due to your everyday posture, you get injured, what can happen is the bone can actually start to shift out of alignment. That could put a lot of pressure on these nerves in the low back, and that can cause muscle tightness, and because those nerves go to the muscles there. It could also start to put a lot of pressure on the discs there, leading to disc herniations and things like that. So I'm going to just give you a couple things that you can do at home to help yourself out, okay? So one of the first things that I told you about that causes those subluxations is sitting. So what can you do? Aside from taking breaks about every 20 minutes, one of the things you can do is get yourself an Instability Cushion like this. And you take this and you put it down on your chair like this when you're sitting at work. And now you're sitting down on it, it forces you to use a lot of these postural muscles. So instead of slouching down in your chair, you're actually forced to kind of stabilize yourself. That's just one of those things that could help you out. On top of that, you can get something like this over here. Now, if you want to get really high tech with it, this is a ball chair, okay? And so you sit on one of these things. Now you're doing that same kind of thing I was telling you about there. If you don't have these things and you want some pain relief right now, I'm going to show you a couple of exercises you can do, okay? So if you can get something like this, this is called a foam roller, okay? You can pick this up at any sports store, or including like if you go to Walmart, Target, lots of different places carry something like this. You want something that's pretty firm, and what you're going to do is you're going to take it and you're going to do some rollout exercises in the morning and in the evening, okay? So let's do it. So we're going to put it on the floor like this. All you have to do is center it in that low back region, and then you're just going to lean back. And when you do that, then you're just going to kind of roll back and forth like this. And by doing that, you can start to lean to one side and work some of the muscles on the right side. And then you can lean to the other side and get some of the muscles on the other side. By doing that, that's going to actually start to take some of those, and if there's any muscle adhesions or knots in the low back, it'll start to actually take care of those and get rid of them. And this feels really good. So another thing, if you don't have this, I'm going to give you another thing. One of the other exercises you can do is it's called your erector spinae muscles. And what all you're doing is you want to stretch these out to really take care of any of those muscle adhesions or knots in there as well, okay? So to do this, you're going to take your hands like this. Say you're feeling a lot of pain in that low back region right here. You're going to take your hand, you're going to cross your hand over like this. You're going to turn over your side, and you're going to slowly stretch out. And you're going to feel that right through that low back there. And then you're going to come around, and then you're going to lean up like this. And then if you want to get the other side, you take your other hand up like this, put your hand over, and then roll out to the side, and you'll feel it right through there again. And then go back across and roll back up. And you could do that like 3 to 4 times. Feels really good for that low back. I get patients that feel really great after they do those exercises. One last stretch for you I'm going to show you is called the Mackenzie Exercise. And what you're going to be doing is you're going to come down onto a mat like this, or the floor, or wherever you're at. And by keeping your hip on the floor like this, you're going to just slowly lift up like this. The key to this one is making sure that your hips stay on the ground. And if you start to feel more pain with this, I want you to stop it immediately, okay? And you can do that for about 20 seconds, just back and forth, like that. And that'll, if there's any disc herniations or things like that, it's going to help to help it out. So I hope this was helpful for you. Hope you got a lot of value out of this. If you have any questions, feel free to contact the office. The number here is 714-582-6235. Talk to you soon. For more great videos, make sure to go ahead and subscribe down below so you can stay tuned for all the latest information. Thanks.